see? It's telling us to rotate our phone.
Oh, we're live.
Yeah,
Right?
but I think it's sideways. Look at yours. See if it...
Well, see, we've got people.
I know, but it's the other way.
Is it sideways when you
Are
see
we
us?
sideways right now? This is what we're trying to figure out in life. Mike, you'll tell us. Are we sideways? Because we may have to start over, and you may need to show us. Yes, we are sideways. Okay, we're just going to have to go this way, I think, because it's not working. And we're going to be a little close together, but we're outside also. Is that better? Are we up and down? Okay, we're going to go with up and down.
Yeah, sorry about that.
Sorry, technical difficulties. By the third time, you would think that we would know what we were doing, but you would be wrong.
Yeah.
So, alrighty. Okay, we're sharing it to the health department page also. Feel free to share. Apparently, doing Facebook watch parties is a thing too. All right,
We're going to have to figure that out. Because
Yes.
we're not sure how that works.
but it sounds like a really good time. We have also instructed other people to, again, as always, feel free to make this your favorite party game or drinking game if you would like. But keep in mind that coronavirus is only killed by 60% alcohol. Don't drink that. That would kill you also.
Sorry.
Okay, so.
Sorry. I didn't have it muted.
Alrighty. Okay, you guys, we're gonna get started here. I know we're a little close. We're outside today because it's beautiful weather. I just touched my nose, I'm so sorry. And we are coming to you live from my backyard. Yay! All right, you guys. We are going to start off with some topics that people have asked us about since we were last together. Do you kind of feel like we're a little bit of a family? We feel like we spent so much time with you all. This is so great. Hey, Mom. Hey, Dad. Just kidding. They're not.
Hey,
on
Meg.
here. Yeah. Hey, Meg. Hey, sister. So we are going to start with a few topics that people have asked us about in the meantime since we were last here on Monday, actually. Every day, a lot of things happen, and so we want to update you on what is new and cool these days. So everyone, hopefully you can hear us okay. We will assume you'll tell us if you can't, and then we'll go from there. Hi, ladies. We're seeing some highs. Thank you. All right. Let's talk travel, Destiny.
Let's do.
What a great
Jen.
topic.
Okay. So the governor just updated the quarantine order to include Louisiana and all of Colorado as of, I don't have the date.
As of I have it pulled up here. We got it.
I think
we're all
it
over
was
this
today. Sorry. We have it pulled up.
We do have it pulled up here. That's all right. Nope, not that one. But we'll keep talking about it. But
yeah, so
do the other states too. That we just remind everybody.
far, anyone who has traveled from Louisiana, Colorado, California, Florida, New York, Washington State, Illinois, and New Jersey. You put New York twice.
Oh, New Jersey.
And New Jersey. If you travel from there and you come to Kansas, then you are mandated to follow a 14-day quarantine.
Yes. And when we talk about mandated quarantines, that means that you have to oh, yes. This is a great time for weed eating. Talk to your local mayor about that. Really bad ideas. Okay, but you are mandated to quarantine, and that means that it's enforceable. So if you know that somebody is supposed to be quarantining, we kind of want to know. We really want to know because we need to help enforce it because that's how everybody's going to stay safe. So, alrighty. Let's see. Another thing that we have in the meantime, since we last talked, we officially have the mandate for a 10-person gathering, and so we from the state. So that's statewide. That's why you might see things like I don't know, any type of gathering. Really, is it fun if you have less than 10 people? Only if it's us two.
Yeah, exactly.
Otherwise, they should have a mandate against this 2-person gathering.
Oh my God.
Not really. Oh my gosh. Okay. Okay, what's next? Go ahead.
No, I was going to say please.
Oh, yes. So as of today, Wilson County, along with the governments of the cities of Wilson County, we have decided that we are going to restrict use of the playground equipment at our parks. So we want to be very clear about that. It's just the playground equipment, the stuff that's going to hold germs, the stuff that kids are going around touching and, coughing on and that kind of stuff. And not always kids. I see adults climbing. If you are climbing, congratulations if you can still do that, climb on the monkey bars, but just not now. Impress us later.
Yeah, and so we want to we want you to go outside, and we want you to be active, and we want you to walk your dog, and we want you to stay healthy. We just don't want you to be on those germy little playground equipment.
Now, run around. I mean, that's always also fun. You can race each other. How great would that be? Just like the old days. You can play tag. You can do all kinds of stuff, but just don't be on the playground equipment. All right, at any of the parks in any of the cities. All right. Hey, ladies.
Oh,
hey,
Nate.
Class of 98 rules. Okay, that was very important. Alrighty. So another question we had was about heart conditions. What kind of heart conditions put you at highest risk? So I've had people ask, if you have high blood pressure, does that put you at high risk? The answer is no. We're talking more about heart disease, and that means if you have blocked arteries in your heart, if you've had heart stents placed, or if you've had bypass surgery, if you have congestive heart failure, things like that. A lot of people have high blood pressure. A lot of us are getting high blood pressure from all of this going on right now. Not this right now. Hopefully we're lowering your blood pressure, but coronavirus in general. So not necessarily high blood pressure or high cholesterol, but some of those other things where you have blocked arteries in your heart that make your heart maybe more susceptible or make you more at risk for having severe disease. Hopefully that answers your question. All right. Do you want to talk about that? We are under this nice little shelter here. That is my segue. How do you play tag 6 feet apart? Oh, Destiny has a fly in her mouth. It's not transmitted by flies in your mouth. I just want to point that out. She is still okay.
You could.
We maybe encourage, instead of tag, maybe dodgeball. Let's throw things at each other.
Yeah.
But not at your faces, because then it'll have droplets on it.
Yeah. So maybe
have
ride your bike, go for a walk your dog.
Maybe
go
less
for a run.
Less contact sports.
Yeah.
Yes. You're hearing this from two of the most unathletic people and uncoordinated people,
sadly,
in the history of Wilson County.
Jason, we're qualified.
Shelters. Shelter in place.
Shelter in place. So this is a big talk right now. I've had a lot of questions about when we'll get a shelter in place order, what a shelter in place order is. I have to be honest, I don't know all of the counties that have a shelter in place order in effect right now. I know there are several, and there are several that are planning for a shelter in place order, including us. We're talking with local officials and county officials and trying to figure out what our thresholds are there. But a shelter in place order does not mean you cannot leave your house ever. What it means is that you leave your house only for those essential things that you have to do: to go to the doctor, to go to the grocery store, to go to the hardware store, even essential things that you cannot avoid. If you can put it off, then try and put it off is basically what these shelter in place orders are saying. It's not you have to live in your house like a little troll for the
Not
next
that
month.
if you live in your house it makes you a troll, but
no, but we don't want you thinking that,
trolls are fine.
Yeah,
Trolls
are fine.
but
We
they're
like
also
trolls,
coronavirus free.
Yeah. So if you can stay away from people, please just stay away from people. That's what those shelter in place orders, that's what they are. So again, we are talking with the city officials from Fredonia and Neodesha. We're I've hair. Talking to Altoona and Buffalo, working on getting all of these small communities together and looking at our thresholds and how we're going to do this.
Yeah. And so don't be alarmed. Don't think that we're going to just throw everybody, throw the world in lockdown. We're not that powerful. We'd like to think so. But we just want to have those conversations because a lot of communities are doing this shelter in place. It's also called stay in place or stay at home or stay safe mandates or safer at home. You'll hear all kinds of ways to say that, but what it really means is just that we don't want people just going about like all the different about the community and all the different counties and all that, and where spread can become worse because people are traveling. So, true story house. Okay, so apparently trolls are a thing. This is what we're getting lots of good facts from you guys. So thank you for chiming in. So we also want to point out that the reason that we talk about these things like shelter in place and staying in place is not because we're trying to make anybody scared and we're not trying to suck all the fun out of life. We like fun in life. I don't know if you noticed this, but we're like really good at it. But it's because we know that when we are really watching what we're doing and where we're going and who we're hanging out with and the contact that we're making, that's what's really making the difference in all these different countries and different states when we are really pretty much helpless, against a virus that has decided to be kind of a jerk. So what we can do is to stop the spread, prevent the spread, and help each other as much as we can. So again, that's why we're having these conversations so that we can talk about the things that we can control and make sure that we're acting as quick as possible. Just a reminder that if we do exactly what we're supposed to do in public health and prevent things from happening, everyone will be like, man, remember when Jen and Destiny were talking about like all this stuff and they totally overreacted, this is dumb. That's cool because we would rather be seen as overreacting than not reacting enough. If we do it right, it means that we did our job and no one will notice that anything happened and it looks like we overreacted. Yeah. So that's public health for you.
That's public health in a nutshell.
In a nutshell. Yes. Help, I'm in a nutshell. Is that? No, that was, okay, that's something else. Okay. What other questions? Oh, do you want to look on, are we able to pull up questions on there? Oh, there we go. Yeah, go back this way.
I haven't seen any come through.
Oh, I think it's... Okay, one other thing. People keep asking about... let's see. Oh, thanks for the awesome shout-outs. People are asking about NSAID still, about whether it's okay to take ibuprofen, Motrin, Aleve, that kind of stuff. Tylenol is not an NSAID. And even though we've kind of covered this a little bit, let's keep talking about it because almost everybody takes an ibuprofen here and there, or they're already on it every day. So it's not going to put you at higher risk for coronavirus as far as we can tell. But for people who have severe disease, for people who are in the hospital, those are the people that people are worried about. But even with that, we don't have enough evidence really at this time to say that we shouldn't be using NSAIDs. But for just average everyday use, we would rather you take your NSAID and just be at the same risk as everybody else than to hear you walking around town moaning and groaning. We don't want you to be hurting. That's us. We want to take away your pain and we'll help you out.
The only other question I see is if breathing treatments help this virus.
So the answer would be if you were having severe lung disease if you, let's say you have asthma or something, that's one of the high risk factors, or COPD or emphysema. You should probably be using your inhalers if you have any type of trouble. If you're on regular inhalers that are kind of maintenance inhalers, keep using those. If you use a rescue inhaler, use that whenever you need it. But it doesn't necessarily keep the virus away, and it doesn't necessarily make it, I guess it helps your symptoms if you do end up with coronavirus. But we worry more about the people who have the severe disease that end up in the hospital, and then they usually will end up on some sort of breathing treatment. Let's see. All right. I think one of the more common questions we have also would be, am I supposed to quarantine? Right? And so it's like my sister's uncles, cousins, nephews, dad of his neighbor, maybe something like that. I'm trying. was exposed to somebody. So we want to remind you that a contact of a contact is not a contact. That's we're going to make t-shirts that say that.
Yeah.
So we want to make sure that we're following the guidelines to say that that you should be quarantined if you meet those guidelines. But if you have had casual contact that's not exposure, like 6 feet for 10 minutes or more, then you aren't necessarily going to quarantine. When in doubt,
Camp out.
we should practice more in between.
Yeah. So, you're welcome for the scenario. So if your cousin had contact with someone and you had contact with your cousin, that is not a contact. You don't have to quarantine in that situation.
If you've already had the coronavirus, this is one of the questions. Can you get it again? It's like any infection. Well, most infections, in that once our body kills it and gets rid of it, and that's really kind of the treatment for most people who will get it, then you should be immune to it. Should be. Right? So your body builds antibodies to it. That's how we kill it off. And then those antibodies stay on guard for when coronavirus comes around again. So again, in theory, and what we see is that you should get it once if you get it, and you shouldn't be able to get it again. But we know people are immunocompromised, or we have other scenarios where that might not be the case.
Or if you do get it a second time, you'll fight it off so much more easily.
Hopefully.
Because you already have those antibodies.
You're sheltered in place in Minnesota. Am I far enough away from you? I'm actually terrible at geography, but I think Minnesota's farther than 6 feet, so I'm going to say you're okay, Mr. Wilson. What's it looking like for people who do have asthma?
Yeah, that was the question.
Yeah. That is one of the higher risk conditions for people. So whereas we are seeing... I guess we're seeing people who are above 60 have more of like a 4% chance of, I guess, fatality rate. Well, the numbers kind of, the percentages are kind of out there. You'll see different references there. But we do see that people who have lung disease, heart disease, diabetes, or cancer, their risk is maybe even up to double that. So we do really want you to be careful if you have asthma. Again, if you're someone young and healthy and have asthma, your risk is different than somebody who's maybe like 80 and has asthma. So it all these factors come into play to determine your risk. What else do we have here?
I don't have any other questions.
Park conditions, parks. Yes, tennis is a good idea. I saw that listed there.
Yeah, that's a great idea.
Rick, you asked about wrestling. Yes, only if you were in a state where we pronounce it wrestling, then you should avoid that, actually. Let's see. A contact is a contact. All right, we're seeing
about ITP.
Oh, ITP. So ITP would technically, we might call that immunocompromised, because that is something that we would consider, an autoimmune type thing in certain situations. ITP, it's idiopathic, and idiopathic kind of means that we don't know where it came from. So I would consider that a condition where we really want to be careful and assume that you're going to be more at risk. Alrighty, breathing treatments. Oh yes, a good activity for children instead of playing on the playground equipment is cleaning their rooms.
Thank you, Mr. Boss.
Yes,
I saw that you were watching.
Yes, that is fact.
That is
Thank
fact.
You very much.
And dishes and
vacuuming
dishes also, and laundry, all that stuff.
Yes,
great forms of physical activity.
Yeah, it keeps you very healthy and keeps coronavirus away.
Yeah.
That's not actually fact, but the other stuff is fact.
No, it's a good idea anyway.
It is a good idea.
Our babies under 1.
Are babies under 1 considered high risk? So we have seen throughout the world that babies are not necessarily at higher risk. Of course, we've had children with coronavirus, and they can transmit it to older or to adults and to older adults who are at higher risk. So that's kind of our biggest concern. We do know there's been some transmission to newborn babies, but again, those are rare cases, and we're really not seeing high death rates. Very rare in children. They're mostly mild disease, and sometimes asymptomatic, meaning that they don't have any symptoms at all.
And Nate, the best source for accurate numbers is obviously us.
Yeah.
No.
2, that's a number.
No, that's a really good question, because there are a lot of experts out there that are not really experts, that are saying they are. So my suggestion would be stick to CDC specifically, stick to KDHE if you're in Kansas. I don't know anything about the Oklahoma Department of Health, but I'm assuming they're really good at what they do. So yeah, stick to those really like basic sources, because those really are going to be the best.
And that's where we look. When we were looking for numbers, we're on the KDHE website, we're on the CDC website. And yes, and if your kids give you any trouble, tell them Mr. Boss said that this is how they're going to stay healthy.
Yeah. Yep.
There was a question about, are the kids who are getting sick, are they ones that are maybe immunocompromised or have other types of chronic diseases? Not necessarily, because kids are getting it, but they might have more severe disease if they do have other chronic conditions. But any kid, any adult can get it. So that's why we're trying to be super careful. Have you seen Oklahoma once on accident? Okay. Oh. Do you want to answer that one?
Yes, right now the hospitals in the county have the necessary protective equipment for all healthcare workers. We all know that there is a national shortage of personal protective equipment, PPE. We all know there's a national shortage, but we are working with our regional and our state partners to fill those needs. And past that, that's really why we are pushing that that social distancing piece. That we just want people to stay apart from one another and slow the spread of disease, so we don't have to use up all that PPE so quickly. Mm-hmm. So I would say that's yes. Right now we have all the equipment that we need.
And you might notice one of the things that we are doing differently than what we had done in the past is we're reusing some of these masks, and that's been okayed by the people who are maskologists. Mm-hmm. But actual professionals who say that we can actually reuse masks, and it's safe for the patient, safe for us, until they get soiled or until they get particulate. That's like a fancy word for if you cough on me and it's your spit. Don't get particulate on me, please. It's kind of gross. So you might see that a little bit more, reusing masks. We're not reusing gloves or anything else, but we might be reusing those masks. Are 4-month shots something that should be put off, or are they too important? You want to answer? You want me to answer?
We are still, the health department is still open for walk-in immunizations. Should we get a case in the county, we will probably close to the public except by appointment. Now, 4-month shots are very important. All of your kids' immunizations are very, very important.
That's all of them.
Yes, all of them. Even adult immunizations. Mm-hmm. So, if we are close to the public and your child is due for immunizations, give us a call. We'll make an appointment. If you are sick and your child needs immunizations, we would ask that you stay home until you feel better and then come in and get them. But no, immunizations are very, very important. And we do want to continue to do that because we know how impactful those are.
Because just as a reminder, we still have a lot of other stuff going around. So even though coronavirus is kind of our focus right now, we've still got strep throat and other viruses. We've got influenza still going on. So we have a lot of other diseases that are around, and that includes the things that we're trying to protect against with these vaccines. So we don't want to ignore all the other stuff and then see a reemergence of measles, polio, all that stuff that we've worked so hard to get rid of through vaccines. So we're very pro-vaccine, just in case you haven't noticed.
Yeah, very
much so. Mm-hmm. All right.
And Carrie, yeah, it's fine for you to still go to the grocery store. If you have an immune compromised child, then I would suggest leave them with a caregiver or at home. You can wash your groceries. I know Jennifer's talked about washing your groceries before. Mm-hmm. Wash your hands, do all the social distancing techniques that we've been talking about, and I really think that. Yeah, we all have to eat, so still go get food.
Yes, and still do what you need to do, but just be safe when you do it. Wash your hands before you go, after you go, and wash the things that you can wash. And as far as washing, soap and water is great. People worry about, do I need hand sanitizer? Do I need special soap? If you're using a bar of soap, wash for 20 seconds. If you're using antibacterial soap, dish soap, I mean, really just wash your hands really well. That's going to be probably the most important message. So don't worry if we're running out of hand sanitizer and stuff like that. Apparently you can make your own.
But you have to be able to buy alcohol, which I also hear is in short supply in the stores.
Okay.
So,
alrighty.
Soap. Lots of soap.
So lots of soap. Alrighty, let's see what else. I missed the advice about groceries. Do you suggest it? We suggest groceries. Okay, moving on. Just kidding. We suggest food. It's a good idea.
Yeah, we like it.
Just be careful when you go out. Grocery shopping, it's an essential thing, so we just have to protect each other also. Allergies and sinus stuff, you might notice. First of all, I think I might be sweating.
Yeah, I'm sweating and my hair is weirdly curling because of
the things we do for corona. We blame coronavirus.
We do. Yeah, my hair looked great before I got out.
Yeah, just
here.
right before. But we still see a lot of sinus stuff, a lot of allergy stuff, and so continue to take your allergy medicine if you normally would, and feel free to call us and we can help kind of differentiate what you have going on. And we may need to see you. We're doing the different clinics are doing virtual visits, phone visits, in-person visits still, curbside visits. I gave injections in the parking lot the other day. I didn't know who the people were, but they looked like they needed injections. Just kidding. I did all the proper stuff. It was fine.
It was fine.
But if you see people out in the parking lot and they're in like full gear, don't be afraid. We're just making sure that the patient is safe and that we're safe so that we can keep working to keep you guys safe. All right, let's see what else we got. 20 seconds is roughly 2 times through the FHS alma mater. Thank you, Nate. We'll have you sing that at the next live session. Wipe down groceries. Can you two still sing?
Yes, but we're not going to.
We're not going to today.
Yeah.
We hope that you are enjoying a little bit of chatting. We feel like we're kind of double dating with all of you out there on a Friday night. I mean, it's very romantic. I mean, we assume that you are looking as longingly at us as we are looking at you.
I can't do that.
I know. It's a little. I hear double guns are back.
Yeah.
Yeah, since we can't really high five and stuff, so we're doing a little bit of that too. I think we got a stink eye from the mayor.
From the mayor. Yes.
Okay, sorry, we're sitting really close, aren't we?
Yeah.
That's all right. So we're
like slipping.
Yes. Hand sanitizer must be at least 60%.
Oh.
So if you don't know what you're doing, don't make your own. Great.
That is
advice.
a really good point. Yeah. So when if you're making your own, know what you're doing.
If you're not sure,
yeah,
don't do it. Oh, where did the comments go? Oh crap, they went away. Okay, let's see. Sorry, I shouldn't say crap. Let's see what else. Other things that we've talked about. I know we're not really good with technology.
Yeah. So,
any other question?
Still waiting on a script for Bruce is still waiting on a script for toilet paper. That's.
We do. I will say that I would recommend that we both would recommend that you guys find ways to connect. And social media right now is a great way to do it. But FaceTime, Zoom, there's a great app called House Party, and you can play games and do like a group chat. I learned that the other day. We're not endorsed by them, but if you know them, tell them to pay us for saying that.
Yeah.
But find ways to get together with people, because this is going to be going on for a while, and we know your mental health is really important, and we don't want people to kind of lose it while we're all trying to keep each other safe. Eventually this is all going to be, back to normal, whatever normal looks like. It may be a different normal, but we're going to be able to be out and about, play on the playground equipment. But for right now, let's take care of each other, both by social distancing, but also reaching out with our modern technology.
One thing, yes, Barbara, G&W is delivering groceries, which is fantastic. The hardware store has started offering delivery and curbside service too, which is fantastic. Everyone is really, I am so proud of Wilson County. Everyone is really doing their part, and they are really, really going out of their way to make things accessible to those who may be at higher risk or maybe frightened by this virus, and that's fantastic. And someone says, is there anything you can use on carpet?
I guess what we're telling people is your usual things that you would normally clean with, like your countertop chemicals, things like that. We're saying that most of those things should be able to kill off the virus. I don't know exactly what you're using on your countertop, so I don't want to.
It was carpet.
Yeah, but so I'm going to say the same for carpet. There's not necessarily anything where we're like, use this on carpet, but if you normally would, like if you feel like there's maybe somebody in the or if there is somebody in the house maybe that's sick.
Yeah,
that would be the time.
And Lysol. Like if you have Lysol aerosol spray, that's good. I know that it's on the approved list. There is an approved list on CDC's website. You can actually just find the whole list of things that that are approved for cleaning. So Lysol is definitely one of them.
All right. Oh, yes, and somebody mentioned if you have somebody in the nursing home, we know that visitors, that's something we kind of want to mention is, I know in most of the hospitals, including ours here in Fredonia, we are not allowing visitors anymore, and that's really to keep everybody safe. It's not that we want people to go through or experience any type of illness alone, but we also know that we don't want to increase the risk for other people there. So, so please do call people in the nursing home, call your people, your family members in the assisted living. They'll let you actually visit through the window, and that's okay too. But I know that that's kind of hard on them too, to not be able to go to their usual dining where they're all in a big dining room together. They're having to kind of isolate even for meals. So watch out for them. Call them. We can figure out. I got my dad to figure out how to use FaceTime. So
really,
yeah. So that's a thing. So anybody can do it. I'm pretty sure.
Yeah, so Mrs. Githens, I saw your comment, and yes, our local restaurants mostly have gone to carry out and curbside only. They are fighting to stay open for their employees and for the community. So that's really, really awesome. And if you want pizza or Mexican food or who else is open?
The kitchen table.
Kitchen table, yes.
And the Hive, I believe, is going to be open for a walk-up window coffee. That's great.
Yeah, so call them, and they will do to-go and delivery. I've actually heard that Pizza Hut will deliver out of city limits to anyone who's in quarantine. Now, this is in quarantine, people that must stay home. The Pizza Hut is making exceptions to their rules.
Make sure you have your quarantine coupon. No. Just kidding. Not a thing. Not a thing.
But yeah, so they're doing a great job.
So a couple of questions about immunosuppression. And so if you have leukemia, any type of cancer, you're at higher risk. If you're on any type of immunosuppressant for like an autoimmune disorder, or if you have an autoimmune disorder of any sort, you would be considered at higher risk. So please, just be careful and know those people around you, making sure that we're taking care of them. And Kitchen Table delivers also. I mentioned that there. Awesome. What else? Rick's is closed. I work there. Okay. Rick's is closed. Sorry. I know some places are closing. And when all of this is great again, and we're able to go back out and about, please plan to go to these different restaurants and different businesses and help them get back on their feet. So, alrighty. Okay, you guys, what other questions do we have? If we missed any, we're really sorry. Keep texting us if they will. We're gonna do our last call. That's what we do. Yeah.
Last call.
Last call for questions.
Last call for questions. You've got a couple of minutes.
I mean, we'll stay on if this really is your date night. I'm sorry, but but like dates are not like as fun because we're all they could be fun. Don't be too fun. Don't get too close.
We didn't say COVID-19.
Oh, we didn't say COVID-19. There's a rumor out there that people are playing a game where if we say COVID-19, they quench their thirst. So COVID-19, COVID-19, COVID-19. There you go. You're welcome.
Mrs. Fitzmaurice, you were in Florida on the 15th. No symptoms yet. Still 14 days. Yes. Yeah. The incubation period of the virus of COVID-19 is 2 to 14 days. So still have to stay in for the whole 14 days just in case.
All right. Yeah, and even people in quarantine, give them a call. Call Mrs. Fitzmaurice. She may want to hear from you guys. So, and yes, please, Deb, great point. Tip your curbside people or carry out people. Again, everybody is kind of hurting these days, and we want to keep everybody as less stressed about finances and life moving forward as we can. So, all righty. Oh, Kelly, you're like I think you're back there. You might be texting from back there.
Oh.
Yay. Got any jokes? Not good ones, Rick. We've already exhausted all of them.
Yeah.
You can't see our pants today. We might not be wearing pants. It's weird for the neighbors. Sorry, Kelly, if you're watching and you see that we don't have pants on. What else?
I haven't. Those are the big questions that we've.
Yeah. So, like we said, we're going to. Oh yes. Okay, that's a great point. Hold on. Whoops. Bugs. All right.
Yeah, Carrie. Not every cough is COVID-19. People are experiencing spring allergies, so be nice to one another.
I mean, some coughs are tuberculosis, so I'm just kidding. They're probably not that, but they could be. I don't know.
Look at my hair.
I hope not. But no, be nice. This is the time also where we, it's very easy to be paranoid and to try to avoid people and say oh, well, I know that they were in Florida or they were blah, blah, blah. So please still be nice to people. People are trying to do their best. And we can't call you Mrs. Fitzmaurice.
We can't, no.
Sorry, we can't call you
We've got to
Laura.
call
That's
you
too
Mrs.
weird.
Fitzmaurice. Sorry.
But please be nice to each other. Everybody, like I said, they're trying to do their best. Nobody is like patient zero that we're trying to avoid. Unless it's us. You're welcome to avoid us. We'll understand. But we just want everybody to take care of each other also. Let's see. Oh, Dr. Hauser, hello. Can you take ibuprofen? We mentioned that a little bit earlier, but just as a reminder, yes, go ahead and take it. It's fine. The worry was about people who had severe illness and whether ibuprofen was appropriate to take. Then that would be the people that are in hospital. So we don't have enough evidence with that. So keep taking your ibuprofen or any other type of NSAID that you might need. All righty. Let's see. Okay, you guys, we're doing a last call. We're going to throw out COVID-19 just in case you're playing at home alone and you needed a motivation to take a little sip. Alrighty. If you missed that part, then we'll explain it later.
I don't see anything else.
And did we talk about did we talk about permits and badges not being needed?
Oh, yes.
That was one thing.
Yes, that's something I forgot. I have gotten lots of questions about permits and badges when talking about stay-at-home orders, specific essential services. Those employees have got to go to work. The health department is not going to be issuing badges or paperwork to identify those essential employees. You're still going to have to go to work. Sorry. But your employer will be open or they won't. So if your employer's open and you need to go to work and you've talked to them and they said, hey, come to work, then go to work.
It's kind of really easy. Go to work if your work's open. Don't go to work if your work's not open.
Yeah.
Right? That's
KDHE, KDM, Kansas Department of Emergency Managers, and law enforcement have all said they're not going to be checking for those papers. They're not going to have to be provided. So
just be honest and
just be honest. Don't just go out and run around. That's what we're trying to avoid.
Yep. And I think what Destiny was saying, badges, you don't need no stinking badges. Huh?
Yeah, I think that's pretty good.
Okay, thank you. Yeah. Okay, that's how we're shutting her down today, I think. Oh, wait. Did you see the mask question N95? Not the public.
Oh, I didn't see that, Kim.
Oh, thank you, Kim.
Yeah, so N95 masks are specifically to keep droplets out, and they need to be fit tested, and you need to wear the right type of badges, and masks, and you need to be trained in how to wear them and how to don and doff them, and healthcare
Don
workers,
and doff are amazing words, right?
Yeah, sorry.
We're also learning
put them on and take them off.
Yes.
So that's why those are for healthcare workers. The other masks are fine for the general public, but really those N95 masks are so important for healthcare workers because they're right in there with those symptomatic people, and they need that extra protection. So
And
please don't go out and buy
And
them
the
all
ones
up.
that we call them surgical masks. You know, they keep your own droplets in. They're not made to keep other people's droplets out, and that's why that you'll see that difference there. So on social media, you're seeing people say, I have N95 masks or I need N95 masks. That's why, because we're trying to protect those healthcare workers. And then the people who are sick have the other masks that are a little bit more readily available, and we put those on people who are sick or coughing or have fevers.
Yeah. So some masks keep it in, some masks keep it out, and there is a big difference in masks.
If anyone has an N96 mask, we'll give you extra bonus points. I'm just kidding. It's not a thing. We're just testing. Yeah. All right. Okay.
All right.
I think that's all we have for today. Like we said, we're going to keep doing this as long as we can be helpful. We hope that we continue to give useful information along with probably a smidge of useless information. But that's just to keep you guessing.
Thanks.
Hopefully you can tell the difference.
Thanks, sister.
Yes, thank you. Thank you, sister. So please keep each other safe. Take care of each other from far away. Thank goodness it's 2020 and we have phones and FaceTime and everything else. Care for each other and make sure that we're doing our best to not spread COVID-19 and hopefully we'll get through this together, but from 6 feet apart.
Yeah.
Except for right now. This is more of like, well, it's maybe the camera adds 5 feet.
All right. Thank you, everybody.
Thank you.